This nationwide cancer survey was deemed necessary as understanding the public's perceptions on the human papillomavirus and cervical cancer screening is of utmost importance in curbing its spread in women, especially since the role that men play in its transmission is seldom addressed, since men are often not included in HPV sensitization. Dr. Camilla Thomas Purcell, Associate Professor at Nova Southeastern University, is spearheading the survey, and she brings with her extensive knowledge, having conducted research with distinguished organizations including the United Nations Population Fund, the National Cancer Institute Center for Global Health, and the Caribbean Public Health Association.
Very similar. People are hesitant about HPV because they don't understand it, right? People will say, oh, I have a son. He doesn't need to worry about HPV. But men get HPV virus too, and it can cause head and neck cancers, throat cancers in men as well. So it's good for both men and women to be protected, just to stop the spread of HPV.
Dr. Camilla Thomas Purcell and other researchers will use the data provided to develop targeted education and prevention programs.
This current research project, we're trying to find out more about the stigma, where it originates, why people have these beliefs, and ultimately, we want to find ways to combat the stigma and replace it with education so that people will be more knowledgeable about HPV and the HPV vaccine, and just understanding that this cancer is very preventable when you take certain steps and the right steps.
The survey is being conducted in Grenada, Jamaica, and Trinidad and Tobago. These prevention programs, Dr. Thomas Purcell said, must also include a sensitization drive that includes messaging that increases men's health literacy on the human papillomavirus. Dr. Thomas Purcell believes that ongoing education programs geared towards men and intervention to encourage spousal communication about reproductive health and shared decision-making may improve awareness of cervical cancer prevention and vaccination. However, there are some societal barriers, she said, that must be addressed, particularly the internal and external stigma associated with the virus.
And because of the way it originates, it has a lot of stigmatization associated with it. So there's a lot of health-related stigma. So you have like internalized stigma. People feel ashamed. They have a lot of fear. And then you have like external stigma that comes from other people, where people blame women for the disease, and then they isolate them and they discriminate against them. And all of these types of stigma, it presents barriers to women going and getting screened for cervical cancer.
The survey is open to anyone between the ages of 18 to 85 and will run until March 2023. For GBN News, Janelle McDonald.